Hi guys, welcome to my YouTube channel. So in this video I'm going to talk about the renal biochemistry. So if you haven't subscribed to my YouTube channel yet, so please go and subscribe and check my. So this is the part 1 of renal biochemistry. Topic is renal biochemistry. So what is kidney? Kidney is the primary excretory organ of the body, histologically composed of outer cortex and inner medulla. Functions of kidney: formation of urine by three mechanisms: glomerular filtration, tubular reabsorption, tubular secretion; excretion of metabolic waste product and foreign chemicals; the regulation of water, electrolyte and acid base balance. It is a homeostatic function. Formation of the formation and secretion of the renin, erythropoietin, calcitriol and prostaglandin; the regulation of arterial pressure along with transamination, deamination, gluconeogenesis, and it is a metabolic function. So now coming to nephron. Nephron is a structural and functional unit of kidney. There are about 1.5 million nephron in each kidney, together responsible for the kidney functions. So there are basically two type of nephron: cortical nephron and juxtamedullary nephron. Cortical nephron are 80 to 85% of all the nephrons. They lie in outer cortex and vasa recta is absent. Loop of Henle is short, not involved in countercurrent mechanism. However, in juxtamedullary nephron, they are 15 to 20% of all nephron lie in inner cortex near the medulla. Vasa recta is present. Loop of Henle is long and they involve in countercurrent mechanism. So now coming to parts of nephron, there are basically two parts of nephron: renal corpuscles and renal tubule. Renal corpuscles are glomerulus and Bowman's capsules. Renal tubules are PCT, loop of Henle, DCT, collecting tubule, or papillary duct or duct of Bellini. So duct of Henle is again divided into three parts: descending limb, U-shaped limb, ascending limb. Descending limb, two parts again: thick segment and thin segment, and ascending limb, thick segment and thin segment. So this is overall the parts of nephron. Coming to renal corpuscles. So as you are seeing the diagram, this is afferent arteriole, this is efferent arteriole, this is Bowman's capsule, this is glomerulus, and this is PCT. So what is renal corpuscles? Head of nephron consists of Bowman capsules and glomeruli is called as renal corpuscles. Bowman's capsule is the cover of the corpuscles that surround the glomerulus. Glomerulus is the network of capillaries inside the corpuscles. So inside the corpuscle there is a network of capillaries made by afferent arteriole and efferent arteriole that is called as glomerulus. Now coming to renal tubule. So tubular passage wave of the nephron is called as renal tubule. So these are PCT, proximal convoluted tubule; DCT, distal convoluted tubule; DLH, descending limb of Henle, ascending limb of Henle, distal tubule, convoluted tubule, collecting duct. Now coming to structure of glomerular membrane. So it consists of three layers: endothelium of capillary, basement membrane, and a layer of epithelial cells, which are also called as podocytes. So this is the diagram in which there is epithelial podocyte cells, along with there is a filtration slit or a slit pore which is 25 nanometer, and it can pass any substance less than 8 nanometer in the diameter. And you can also see the glomerular basement membrane and the endothelium capillary cells along with the fenestra. These are the fenestra. These are the pores in the capillary walls of 70 to 90 nanometer in size. So now coming to glomerular filtrate. So it is the fluid that filtrates through the glomerular membrane into Bowman's capsules and contain a lot of water, also important molecules like glucose, amino acid, salt, and excretory material along with urea. Criteria of glomerular filtrate will be that it is isogenic to the plasma, that means have same osmolarity, that is 300 milliosmol per liter. pH is 7.4 and doesn't contain blood cells or protein, as the glomerular membrane doesn't pass the blood cells and protein. Coming to basic process of urine formation, these are glomerular filtration, tubular reabsorption, tubular secretion. Coming to glomerular filtration, filtration of plasma from the glomerular capillaries into the Bowman's space is termed as glomerular filtration. Filtrate contain all plasma substance except protein and blood cells. So now Tubular reabsorption. Movement of substance from tubular lumen to the peritubular capillaries is called as tubular reabsorption. Tubular reabsorption mainly occur in PCT and the loop of Henle, and it is occur through diffusion or through mediated transport. Now coming to tubular secretion, it is also called as reverse of tubular reabsorption because in this the movement of substance will occur from peritubular capillary to the tubular lumen. So tubular secretion occur via diffusion and transcellular mediated transport. And hydrogen and potassium are the most important substance secreted in the tubules. So there are three processes of the urine formation: glomerular filtration, tubular reabsorption, tubular secretion. Glomerular filtration rate is 180 liter per day, tubular reabsorption rate is 179 liter per day, and tubular secretion rate is 1 liter per day. So now coming to GFR. So what is GFR? GFR is glomerular filtrate rate. It is the amount of filtrate produced by all the functioning nephron of both kidney per minute, may be regarded as a test to test the both kidney are working properly or not. So renal blood flow determined by the GFR may estimate amount of blood passing through the glomeruli during each minute. Normal value in case of female 10% less than male, and the normal value in adult is 125 ml per minute, or we can say 180 liter per day. So what are the factors affecting GFR? So the factors affecting GFR are glomerular capillary hydrostatic pressure. It is 60 millimeter mercury, that will increase the GFR. Glomerular capillary colloidal osmotic pressure, it is 32 millimeter mercury, and it will decrease the GFR. Bowman's capsule hydrostatic pressure, it is 18 millimeter mercury, it will decrease the GFR. Bowman's capsule colloidal osmotic pressure is 0 millimeter mercury, and it will increase the GFR, along with glomerular capillary filtration coefficient, that is KF, is directly proportional to GFR. So if it will increase, then it will increase GFR, and if it will decrease, then it will decrease the GFR. And size of capillary bed will decrease, KF value will also decrease. So GFI is directly proportional to KF value and also the capillary bed size. Renal blood flow will increase and GFR will increase. Sympathetic nervous system shows positive stimulation, then GFR will decrease, and if it get inhibited, then GFR will increase. Constriction of afferent arteriole, GFR will decrease. However, constriction of efferent arteriole, GFR will increase. With glomerular hydrostatic pressure in moderate constriction, it will increase. In severe constriction, it will also decrease. So afferent arteriole constriction will decrease, and efferent arteriole constriction will also decrease, but in severe constriction. In normal or in moderate constriction, it will increase the GFR. So hormones and autopoids, so epinephrine and non-epinephrine will decrease the GFR. Endothelins will also decrease the GFR. Prostaglandin will increase the GFR. Bradykinin will increase the GFR. Angiotensin 2 will decrease the GFR. Renal vasoconstriction occur, then GFR will be reduced. Renal vasodilatation occur, then GFR will increase. So these are the factors that will affect the rate of GFR. Now coming to the juxtaglomerular apparatus. So what is JGA? The JGA is a combination of specialized tubular and vascular cells located near the glomerulus of each nephron. So it consists of juxtaglomerular cells and also the macula densa. So juxtaglomerular cells, these are the cells in the wall of afferent and efferent arteriole, are also called as granular cells because presence of secretory granules in the cytoplasm, and the function will be release of renin, which will increase the blood pressure and ECF volume by renin-angiotensin mechanism, release of erythropoietin, which will stimulate the erythropoiesis, and autoregulation of renal blood flow. Coming to macula densa. So macula densa is a specialized group of epithelial cells in the distal tubule, and its function is play important role in the feedback mechanism called as tubuloglomerular feedback mechanism, and it will regulate the renal blood flow along with GFR. So besides JG cells and macula densa cells, another cells is called as JGA. So now there is another component to it, that is extraglomerular mesenchymal cells. So these cells are also called as agranular cells or Lassis cells or extraglomerular mesangial cells. These cells are situated in the triangular region bound by the afferent arteriole and efferent arteriole and macula densa cells. So their function is they play important role in regulation of glomerular filtration by their contractile property. Filtration fraction. So it is a fraction of renal plasma flow that becomes glomerular filtrate. Calculation will be filtration fraction is equals to GFR by renal plasma flow into 100, that is 19%. Now coming to renal plasma flow, it is the total amount of plasma passing through both kidney per minute. It is about 650 ml per minute, that is 55% of renal blood flow, and RBF renal blood flow is 1200 milliliter per minute. So from both the kidneys and 650 ml per minute in single kidney. So now coming to plasma load. So what is plasma load? Plasma load of a substance means the total amount of that substance present in plasma that passes through the kidney in each minute. So its formula will be renal plasma flow and multiplication of plasma concentration of the substance. So example will be like plasma concentration of glucose will be 100 mg or 100 ml or 1 mg by ml. So RPF will be 650 ml per minute. So plasma load of a glucose will be 650 mg per minute. So what is renal blood flow? Total amount of blood passing through both kidney per minute is called as renal blood flow, and it is 1200 milliliter per minute, that is 4 milliliter per minute per gram of the blood. So now coming to tubular load. The fraction of plasma load that filtrates into glomerulus in each minute is called as tubular load. It is GFR multiplication of plasma concentration of the substance, and its value will be 125 mg per minute in case of glucose, and it is directly proportional to the plasma concentration of the substance. Now coming to transport maximum. So what is transport maximum? The maximum rate at which a substance is reabsorbed or secreted per minute in the kidney tubule is called as transport maximum. Significance will be if tubular load will increase Tm value, then the excess substance is not reabsorbed but excreted in the urine. If tubular load will have less value than the transport maximum value, then substance is totally reabsorbed and not excreted in the urine. So in case of male it will be 375 mg per minute, and case of female will be 300 mg per minute. Transport maximum of lactate will be 75 mg per minute, and plasma protein will be 30 mg per minute, and creatinine will be 16 mg per minute. So when tubular load will increase and tubular transport maximum will be less, then substance will appear in the urine. Then if the tubular load and the transport maximum will be same or transport maximum will be more, then substance will not appear in the urine. So transport maximum of glucose is 375 mg per minute, means maximum 375 mg glucose can reabsorb through the tubule in each minute. If tubular load of glucose is above this value, then it will not be reabsorbed through the kidney tubule, and definitely it will appear in the urine. So now coming to renal fraction. Percent of cardiac output is supplied to both kidney per minute is called as renal fraction. Its value is 24% normally, and range is 20 to 25%. Now what is filtration coefficient? It is the GFR per unit filtration pressure, that is GFR per unit net filtration pressure. It is around 12.5 ml per minute per millimeter mercury. So what is renal threshold? It is the plasma concentration of a substance at or below which the substance will not appear in urine, but above which it will appear in urine gradually. Renal threshold of glucose is 180 mg per deciliter. Renal threshold of glucose will be smaller than equal to 180 mg per deciliter. Glucose will not appear in the urine, but whenever the plasma glucose exceeds more than 180 mg per deciliter glucose, it will start appearing in the urine. So now coming to renal clearance or renal plasma clearance. So renal clearance or renal plasma clearance will be the renal clearance is the volume of plasma that is completely cleared of the substance by kidney per minute. So its formula will be plasma clearance represented by C then urinary concentration of substance ml per minute, multiplication of volume of urine ml per minute along with the plasma concentration of substance in division, that is in mg per ml. So this is the formula of renal plasma clearance, and you can see the value of renal clearance of creatinine is 140 ml per minute. Renal clearance of insulin will be 125 ml per minute, and urea will be 70 ml per minute. So renal clearance will be equal to GFR if not reabsorbed and not secreted. Example in case of glucose. If renal clearance become less than GFR, substance partially reabsorbed. Example urea. If renal clearance more than GFR, substance partially secreted. Example creatinine. Criteria of a substance that is used to measure the plasma clearance. So there are some criteria by which we can measure the renal plasma clearance, like safe to administer, freely filtered, not albumin bound, neither reabsorbed, not metabolized, no toxic. Importance of plasma clearance. So it is a good marker of kidney function. With renal failure, the plasma clearance will decrease and plasma concentration will increase. It is used to determine the GFR and renal plasma flow. Used for calculation of filtration fraction, determination of effective dose of drug which are cleared by the kidney, and for assessment in the renal impairment. So now coming to osmolar clearance, it is the virtual volume of plasma that contains the total amount of osmotically active substance excreted out through the urine per minute. It is represented by this formula, and this osmolar clearance, this is the urinary osmolarity, this is the volume of urine, this is the plasma osmolarity. So in normal individual, it will be around 3 ml per minute. That means amount of solute excreted by an individual through urine or defect of the volume required to dispose of urinary solid load. Now coming to free water clearance. So as you can see, it is the volume of water excreted through the kidney per minute in excess or defect of the volume required to dispose the urinary solid loads. And its formula is CH2O is equals to V minus COSM. So it is free water clearance, it is the urinary volume, it is osmolar clearance. So in normal adult, value will be CH2 will be minus 2 ml per minute. In isotonic urine, it will be 0. In hypotonic urine, it will be positive, and in hypertonic urine, it will be negative. Why it will be negative? Because urine is much concentrated in plasma, so a sub excreted in urine with the presence of less water than in the plasma. Obligatory urine volume. The maximum concentrating ability of the kidney dictates how much urine volume must be excreted each day to rid the body of waste products of metabolism and that are ingested. Now calculation will be a normal 70 kg human excrete about the 600 milliosmol of the solute each day. Depends upon two factors, that is total excretable solute about 600 to 800 milliosmol per day, and renal concentrating power, that is around 1200 to 1400 milliosmol in normal adult. If maximal concentrating ability of kidney is 1200 milliosmol per liter, the minimal volume of urine that must be excreted called as obligatory urine volume, and calculated as excretable solute load by maximum concentrating power of kidney, that is around 0.5 ml per day. This brings my video to an end. Part 1 of renal biochemistry. I hope you like this video, and if you like this video, then don't forget to like, subscribe and comment below. I will upload part 2 of renal biochemistry soon. Thank you.